Hello everyone, my name is Lena, and for my final presentation, I decided to do the use of psychedelics in palliative care. A little bit of background, palliative care is specialized medical care focused on improving the quality of life for people living with serious illnesses. It aims to provide relief from symptoms, pain, and stress associated with these illnesses, regardless of the patient's age or stage of disease. This approach to care involves a multidisciplinary team of doctors, nurses, social workers, and other specialists who work together to address the physical, emotional, social, and spiritual needs of both patients and their families. Psychedelic drugs and palliative care is becoming a promising frontier in addressing the psychological and existential distress often experienced by patients facing life-threatening illnesses. Psychedelic drugs such as psilocybin, LSD, and MDMA have shown potential to alleviate symptoms of anxiety, depression, and fear of death in terminally ill patients. As research in this field continues to expand with over 100 clinical trials currently registered, the integration of psychedelic-assisted therapies into palliative care programs is becoming an increasingly important consideration for healthcare providers and policymakers. So, what exactly are the psychedelic drugs? The first one is psilocybin, which comes from a certain type of mushroom found on almost every continent. This mushroom is more commonly known as not LSD, as shrooms or magic mushrooms, and it has the potential to change a person's sense of reality, leading them to see, hear, and feel things that are not happening in real life, or to experience reality in a different way. The next one, lysergic acid diethylamide, which is more commonly known as LSD, is originally derived from ergot, which is a fungus that grows on rye and other grains. This is a drug that can alter a person's perception of reality and vividly distort the senses. Lastly, we have MDMA, which is also called Molly or ecstasy, and it is a lab-made synthetic drug that has effects similar to stimulants like methamphetamine, although some researchers and organizations consider MDMA to be a psychedelic drug because it can also mildly alter visual and time perception. So, why exactly is the use of psychedelics in palliative care significant? Well, first of all, it can address unmet needs of patients. There are rapid and sustained effects. It can improve the quality of life of patients. It can transform perspectives on aging and death. There is a potential for spiritual and psychological insight. It can address treatment-resistant symptoms, and it can complement existing palliative care models. And lastly, it could be more cost-effective. One that I think is very important is addressing the unmet needs of patients because psychedelic-assisted therapy offers a novel approach to alleviating psychological and existential distress in terminally ill patients, which is often inadequately addressed by conventional treatments. So, how can psychedelic-assisted therapy be safely and effectively integrated into palliative care to improve the quality of life and emotional well-being of patients with life-threatening illnesses? I feel that this question highlights the need for a comprehensive approach to integrating psychedelic-assisted therapy into palliative care, potentially revolutionizing end-of-life care and addressing the complex emotional and existential challenges faced by terminally ill patients. Some tentative stakeholders of the use of psychedelic drugs in palliative care are, of course, terminally ill patients and their families, palliative care physicians and nurses, mental health professionals, regulatory bodies like the FDA, and healthcare institutions. Some potential ethical frameworks are principalism, which can include autonomy, beneficence, non-maleficence, and justice. Next one is utilitarianism, which includes evaluating overall psychological and existential benefits, assessing long-term impact on patient quality of life, weighing individual and collective potential outcomes. Next is virtue ethics, which is emphasizing compassionate care, preserving patient dignity, focusing on holistic healing approaches, and considering the moral character of medical interventions. The last one is care ethics, which consists of prioritizing relationships and contextual understanding, emphasizing empathy and emotional support, and recognizing the unique psychological needs of patients in palliative care. In conclusion, the integration of psychedelic-assisted therapy into palliative care represents a promising frontier in addressing the complex emotional and existential needs of terminally ill patients. While challenges remain in terms of regulatory hurdles, safety protocols, and ethical considerations, the potential benefits for improving quality of life and emotional well-being are significant. Moving forward, ongoing research, open dialogue, and thoughtful implementation will be key to realizing the full potential of this innovative approach in palliative care.